We're going to be talking, of course, about COVID-19 and the updates today. And I'm joined with Dr. Rosalie de Lombaert, who's here with me. She's my team member here at Prosper Natural Health, and I'm Dr. Molly Force, the clinical director here at Prosper. And we are super excited to talk about COVID today, specifically really focusing on the latest and greatest information that's come out in regards to natural supportives that can be used. This is part of a series that we're trying to do for education for our community and beyond to kind of help people understand some questions that are coming up in our office specifically and really have it be very relevant to you all. So each month we're choosing a different topic that's going to be relevant to what's been asked in clinic. And you can check out our prior doc talks on our website at prospernaturalhealth.com under the education tab. So feel free to peruse through those. We always try to put our recordings up after. Today, we're going to be talking about COVID. I know there's a lot of questions coming up about the new variant, and if there is one, what's going on with this current wave. We're going to jump into some of the primary literature specifically on natural alternative complementary medicines and therapeutics for both acute and long COVID. So let's get started. The big question about if there's a new variant. Now, this information just came out this week, and basically we're looking at this Omicron that we've had very established here in the US, and now this new variant that we're really watching is BA2.86. We see it has started to enter the States, but the majority of what we're dealing with is still Omicron. Now, why this is important, and you'll see that Washington is highlighted down here as one of the states where this new variant is occurring, is that, as epidemiologists are kind of trying to understand what's going on with this new variant, we want to know if it's going to be more infectious and cause more infections for people, and if it's going to be more virulent, meaning more damaging and more morbidities that happen or death that's happening because of this new variant. So this is very early research, so we're still collecting a lot of data, and we're looking forward to more of that being released. But what they're seeing so far is they had really expected this to be about 10-fold more infectious than Omicron, and they were seeing that it was a little bit lower than that, closer to less than half of that amount. So that's kind of good news for us. We're also seeing that prior immunity to something like having another strain like the Omicron or Delta strain actually does provide some protection for this new variant that's showing up here. So that's all good news for us, but we still want to remain vigilant. Now, a lot of you might be wondering what the heck is happening right now, because we are in the middle of a very late summer wave, and we're on this trajectory of fast rising quantities of COVID diagnosis. We see that hospitalizations alone have increased over 8% in the last 2-week period, which is pretty major. And we see that deaths have also increased 10% from COVID-related illness in the last 2 weeks. So this is a big deal for us. And we know many family members and many patients. We're seeing patients daily who are dealing with acute COVID. So this is really the time that we want to buckle down, pay attention, see what we can do for our bodies to protect us, protect our community members moving forward here. And a lot of those things can be accessed through natural therapies. So that's what we're here to chat about today. We wanted you guys, this is the dry part of the talk, but we wanted to remind you that as evidence-based practitioners, we like to kind of understand the science behind what's going on. And there is this beautiful biochemistry that really helps us map out and understand as scientists what's going on with COVID and how this virus works, why it's so infectious for so many people. So we've got these targets that we see that are receptor targets on the virus, and then cell receptors that people have that interact with the virus. And we've listed these here for you so that you can go back to them, because we might be mentioning them today, some of these in the talk. There are certain herbal medication and certain natural remedies that work specifically on the virus's target proteins here. And what's kind of cool is because we're now 3 years into this research, we're starting to really be able to identify those exact locations that some of these more complementary and alternative medicines are working on to really disarm this virus. So specifically, we're going to be I just want to mention, you guys probably see here like the spike protein. That obviously rings a bell because of how it works with the target of the vaccines that have been made. You'll see the little picture down here of the virus. Many of you are familiar, of course, with those little spikes coming out of this sphere, which is that COVID ball. And inside is the genetic material, that RNA, which has this, all the genetic material of the virus that tells it what to do. So a lot of these medications are going to have direct response on these different areas of the COVID virus. We're going to pass it over to Dr. Rosalie.
Thank you, Dr. Molly, for that intro. So, thinking of the new variant, it will be probably named with a Greek letter coming up soon. What they decide to name it, we'll see. It's sort of being monitored right now as a variant under concern. So we'll see if it gets its own name, its own label as we get more data in. But the current wave is not caused by this current new variant that they're monitoring. It's caused by, the regular old Omicron, and just I think summer being summer, and that a lot of people are in close quarters together, and ultimately that's sort of been deemed as the cause for the current increase. People are traveling more on the airplanes, etc. Good data too on the new variant is that the existing antibodies are showing the antibodies against the Omicron specifically are showing to be helpful against BA.2.86. So it's like the booster vaccines that you got, or if you got the wild type Omicron, there is good data on that being preventive for this new variant. So we're just monitoring pretty closely. But when it comes to acute COVID, right, we're all pretty familiar with the symptoms: sore throat, congestion, runny nose, muscle aches, headache, fever, diarrhea, even dry cough, kind of a burning sensation, even some shortness of breath and fatigue, as well as new onset loss of sense of smell or taste. The emergency signs, that I just want to make sure are reviewed is just when you have trouble breathing. So you can't quite finish a sentence because you're so ill, right? You're having to really catch your breath. You can't quite make it across the room. Those are sort of emergency signs that we'd want to send you, not to our office, but more to the ER. Persistent chest pressure and pain, that's another big one. New onset confusion, low oxygen status, mental status change, bluish lips or face. So it's pretty rare that we get patients who walk in the office or, do telemed with us with these symptoms. The current strains are leading to less severe outcomes, and especially with the vaccination or the previous illness, we're seeing less hospitalizations. But a good reminder too is that the incubation period from when you were first exposed to the virus to when you actually show symptoms can be anywhere from 2 to 14 days, which is just why, it's just wild to think of this. Maybe you had an exposure 2 weeks ago, and now you're suddenly realizing, I've got this scratchy throat, just starting to have a fever. So this is part of COVID's, this is why it's so sneaky. It's good. It's really good at hanging out low grade and just starting to gently infect someone until, and during that whole period, you're potentially infectious. The contagious period, again, it totally depends, but it can be 3 to 15 days. You're most contagious the day before you have symptoms and the day of your first symptoms. So it's just There's some people walking around who are asymptomatic, who are just about to start their first symptoms, who are very contagious. So, you know, COVID's a very smart little virus. And so on to our next slide here, to talk through the research, the newer research on herbal medicine against COVID specifically. I wanted to pull out one of my favorite herbs here, and there's a lot of good data on andrographis, which is, you know, both a Western and an Eastern herb, as being a potent antiviral. Andrographis is not only shows a strong action against COVID, but it's also a major antiviral for flu and herpes simplex. So when I think of viruses, I always reach for this herb. One of the blurbs that I pulled out here that you can see and that I highlighted was that treatment with andrographis for SARS-CoV-2 was the viral cells were significantly inhibited, which means that they're dampened down by this herb. Andrographis binds to that 3CL-Pro protein that we discussed earlier. It's one of the proteins on the virus that connects to the host cell, the human cell, and allows it to put its genetic material in the host cell so it can replicate using our host machinery ultimately in our host cells. So that's pretty cool that they've identified that, wow, andrographis works right on that receptor right here, which is the same receptor that Paxlovid works on, the prescription medication that has been approved for treating COVID. This next slide is really, really exciting to me as well. Quercetin, being a food-based ingredient in things like apples, berries, grapes, citrus fruits, also in a lot of medicinal plants. Quercetin also works on that 3CL-Pro protein of the virus to inhibit it. I highlighted here that quercetin inhibits viral entry, absorption, and penetration of the SARS-CoV virus, which means that we basically stop it in its place, preventing it from interacting with the human cell to then replicate and make more virus. So really, really potent, cool botanical medical information. Quercetin not only is a good antiviral against COVID, but it's also a general antimicrobial, a general antiviral, an anti-inflammatory, an antioxidant, and immune modulating. So when we think about how are we going to help with the symptoms of COVID, you know, the fact that it's antiviral is really helpful, but there's all these other additional pieces that help our immune system fight against the virus as well. The dose in the study had it at quercetin at around 360 milligrams twice a day. So really cool stuff. It's also been researched for previous strains of the SARS virus. So whether it was SARS-CoV-1 that we saw a dozen years ago in China, or the MERS virus, which are similar coronaviruses to SARS-CoV-2, but this one has previous research on it against those coronaviruses as well.
For our evidence-based naturopathic practice, this is the kind of thing that gets us really excited because, of course, we're primary care physicians, but being able to have these natural tools that have really good evidence that have been researched for other viral models as well, it's just really exciting. And I'm so thankful that there are research studies and money going towards the kind of research for these kind of things, because quercetin is such an accessible tool for so many people, and such a safe one for so many people. We wanted to also make sure we talked about nasal sprays. Now, there's a type of nasal sprays called in the category of nitric oxide nasal sprays that are really cool because this fits into that category of how do we prevent acute COVID and reduce the rates of it? And how do we deal with the acute COVID symptoms and reducing the intensity of it? And what we find with these nitric oxide sprays, there's a picture here in a second, but they help with this vasodilation component of the vascular membranes in the area that's most transmissible for COVID-19, which is going to be our nasal mucosa. And what they found is it affects that binding of the virus to those into those host cells in the mucous membranes. And so we can get really significantly reduced amounts of viral load, even for people who've been exposed with COVID. So there's the suggestion with this type of application for use to help reduce risk of actually getting COVID if you're exposed, and the transmission of using it almost like a hand sanitizer style after you've been exposed, but for the nasal passages. And then we also see that it helps reduce the inflammatory response for the body itself. It reduces the risk of thrombotic events, which is pretty phenomenal. And then because the people who are using these nitric oxide nasal sprays, if they do get COVID, we see in the research that it reduces their viral load significantly. So that means their risk of passing it on to their family members who might be in the same household or other people that they're exposing is much less. And this is a pretty low risk product too, very, very low for complications on this, with this strong antimicrobial effect. Now, unfortunately, this product, these nitric oxide products are not available in the US at this point. There are patients who are getting them shipped in, and they are under review right now. And these have actually been studied for other viral models as well, such as the flu in the past as well. Pretty cool stuff. Now, we wanted to make sure we addressed long COVID because this is also coming in as a daily set of questions for us in our clinic. There are so many people or loved ones of our patients who are experiencing these horrible post-viral syndromes, specifically long haulers COVID. So the definition that has been set up by the WHO, the World Health Organization, for that is saying if your symptoms of the initial viral COVID experience lasts longer than 12 weeks or 3 months, then with no other explanation, then we're possibly looking at long haulers COVID or long COVID-19. Now, the symptoms that we see most persistently with our patients who are suffering for this include difficulty with energy, so major fatigue. They might be more prone to pain as part of that because we know that the pain and the energy pathways are very intertwined in the body. Many of them complain of cognitive disturbances, headaches, difficulties with concentration, and then also some cardiac and vascular abnormalities. They can also be experiencing sleep disturbances that seem to make all of those symptoms much worse. Now, we did an entire talk on post-viral syndromes, kind of specifically weaving in information about long haulers COVID-19 within that. And that was done just a few months ago. So if you want to jump on our website and get a really good deep dive into that, please do. We wanted to make sure we provided some updates to new information and new things that are being used to address long COVID. So with long COVID, we're still in the theory phase of trying to figure out scientifically why this happens to people and how it even happens. So there are four major theories which have been presented. The first one is this idea of what we call viral persistence, which means the genetic material of the virus itself, that RNA, is not leaving the body appropriately. So for whatever reason, the folks with the long haulers cannot get rid of that virus. It can't shake that virus. The second theory has to do with what they call unusual immune cell activity, specifically seen in the T cells of some of our folks that have post-viral syndromes. There's an abnormal response to the immune system, to this virus, and then that persists as a reaction, an immune reaction that persists because the body can't mount the correct response. The other theory here that has come up is that of what we see with other viral reactivities. And that category really encompasses like the Epstein-Barr or the mononucleosis theories about chronic viral reactivity, where the virus can be dormant. We see this, for example, with shingles, with the chickenpox virus, herpes zoster, where it can flare when our immune system is suppressed, and we can get this reactivation of a dormant virus. And then the fourth theory that's kind of more specific to COVID is this idea of microclot formation. And they believe that these microclots, which we have had documented extensively for COVID-19, form whenever there is immune activation that basically calls in these damaging events that causes thrombosis or these microclots within the vessel linings. And that has been shown to cause a lot of problems and a lot of damage that can persist for some longer than 3 months. So those are the four main theories. And we wanted to just touch on those before we jumped into some of the newer research about what's available for long COVID, because it's really important for us as naturopathic physicians to understand the physiology of what we're treating. What are we trying to really get the body to do in the first place? That's where the whole treat the cause adage comes in. So one of the cooler studies that really made me feel good was this one about green tea, because green tea, we know, is a very established antioxidant. The main active ingredient in there, that EGCG, is one that we've used for years in our clinic to be an antioxidant for people. We know that it also has antiviral potentials and that it helps reduce some of the mucus production. And that was one of the coolest things that came out of this, is that with more chronic COVID as well as some acute COVID, we worry about abnormal airway mucus production and then the damage that that does secondarily. So we know these polyphenols or antioxidants are really rich in our green teas, specifically my morning drink, which is matcha, which is that beautifully powdered bright green tea. That's going to be super high in these EGCGs. And you can also get those in a supplement form, an extract form. But how cool to be able to have a natural antioxidant that's going to be helping with cellular cleaning and cellular healing, as well as reducing that excess mucus buildup that happens. Another one that's near and dear to my heart is melatonin. Now, what we've seen from melatonin essentially is that it helps speed recovery of COVID-19. So we saw here in this study that patients who were taking melatonin at the dosage of about 9 milligrams a night for 2 weeks during their acute infection of COVID-19 drastically had reduction of inflammation and symptomology of acute COVID. Now, this also has been linked with the reduction of that thrombosis. Remember those microclots we get really concerned about, and death, mortality rate. So melatonin is such an inexpensive, low risk supplement, once again, that we are so pleased to see these studies show how strong of antiviral activity it has. Now, the research about this has even gone on to say that the virus of COVID-19 itself affects that pineal gland. And that pineal gland is the area in our brain that's releasing the melatonin. And so by giving the melatonin, we're actually overriding our own pineal gland when we're doing that supplementation. And that can affect how the immune system sees that melatonin and what it does with it. And we know that if we're endogenously, that means our body is making our own melatonin with COVID-19, we do have a risk of higher incidence of things like cytokine storm and some of those more damaging things we worry about in severe COVID cases.
Thanks, Dr. Molly. I'll take it from here with this new research on vitamin D. And there's been a lot of studies on vitamin D, different dosages, some that have come back saying 60,000 IU for a few days really helps, or this one's coming back as, just a 5,000 IU, 5 to 10,000 IU a day. So whether the dosing ends up being a very individualized discussion with the patient, knowing what your vitamin D status is paramount to knowing how you dose it. But the research is very promising for vitamin D in decreasing the severity of COVID symptoms. So that's just talking about acute and long COVID, right? There's also data that shows that a low vitamin D status prior to getting the infection means that you have a longer and more severe course of COVID. So this one acts in all three places: prevention, acute, and long COVID. And so ultimately, vitamin D3 specifically has been seen in a robust amount, has been seen to decrease the severity of symptoms. I really like this study specifically from January of this year because it's what's known as meta-analysis, which means it's looked at all of the other information out there in primary literature on vitamin D and put it together and made a recommendation from it. So vitamin D comes back strong against COVID. This next slide is on glutathione, which is an antioxidant, very potent antioxidant, especially for the lung tissues and the mucosal tissues in general. But the big takeaway with glutathione is that it reduces thrombosis. So thrombosis is the action of blood clots being formed in the cells, whether they're microclots or more major clots. But with long COVID, as Dr. Molly mentioned, one of the theories is this microclot formation. So as your body is infected with the virus, it puts a whole bunch of inflammatory cells against it to try to have a robust immune response to clear it. All of those inflammatory cells that your body makes ends up being inflammatory also to the endothelial lining, which is the interior of the vascular system, like the center of your donut, we'll say. And so that inflammation in the blood cells means that we're less able to get oxygen to, the periphery of the body, the hands and feet, or even we're less able to oxygenate all throughout the body, giving oxygen to the brain or into the deep depths of the respiratory system. So the fact that glutathione comes back as reducing thrombosis is really promising if we're working on the assumption that long COVID is linked with microclot formation. Glutathione specifically is, I've used it prior to the pandemic with patients who have COPD, or chronic obstructive pulmonary disorder, which is, again, kind of a low oxygen state. I know Dr. Molly has used it for patients with Parkinson's, which is, again, sort of injury to the brain. So we're boosting oxygen by giving a high dose of an antioxidant. What glutathione does as well, or what has been seen, especially in this study, is if your glutathione status is low, they've noticed an increased level of viral replication. So you get more viral load. an increased level of inflammatory cytokines, which could potentially even lead to a cytokine storm, right? The kind of scary sequelae of COVID that we saw, especially in the beginning with prior to vaccinations. And then an increased level of thrombosis, that clot formation, and a decreased ability for the macrophages to remove all that inflammation. Macrophages are just an immune cell in the body that is like a garbage truck. So it just pulls all of the garbage off the road and recycles it, or not, it doesn't recycle, it gets rid of it, so that the road is clean again. So it does that. Glutathione, when your glutathione status is low, your body is less able to do that cleaning up work that is essential for recovering from COVID and dealing with trying not to get to the long COVID state. So glutathione, pretty big one. It comes in all sorts of different formulations, whether it's intranasal, liposomal, in a pill form. It just needs to be a reduced form of glutathione if you are going to supplement it. This research here is on a new type of supplement, which is known as SPMs, which are specialized pro-resolving mediators. Okay, they're basically just they're extracted from fish oil. It's sort of in the same family, and these SPMs have a lot of good data on decreasing inflammation, especially the high inflammatory load that COVID causes. So when we think about the inflammation from your immune system fighting against the COVID virus, that's what we're working on, especially with long COVID, is how do we diminish that big inflammatory load that the body, depending on the genetics sometimes, or the epigenetics, the body has a hard time cleaning up all of that inflammation. SPMs, it's all about doing a high dose, kind of loading dose is sort of how I prescribe it in office. A high loading dose of these extra special antioxidants, and then kind of tapering down to a more regular dose. What SPMs do is that they help the immune response, the dysregulated immune response, in cleaning up the debris from the virus and the response to it, without necessarily boosting the immune system action. So, it's a difficult thing to explain, where we want to support the immune system, but we don't want to ramp it up, because if we have too much of a ramp up of the immune system, then we're creating more inflammation, if that makes sense. So the SPMs have shown to sort of help support the immune system from an antioxidant, immune modulating perspective, without also stimulating an immune response.
We have a lot of patients who come to us talking about naltrexone, or who are on naltrexone, and we wanted to make sure we included that today as well, specifically with our long haulers in mind. So many of you may have heard of naltrexone. It's the active ingredient in Narcan, which is used for opioid overdoses. You know, all those big advertisements, the big billboards when you're in larger cities that show, Narcan saves lives, that kind of thing. So that's the rescue medication that's used for opioid overdoses. Now, naltrexone is given at much higher doses when we're looking at for rescue agent for opioids, or for reduction of, say, alcohol use or something like that. What they found is in a very small amount dosed, so they call it low, it's been coined low dose naltrexone, that it has an immunomodulating effect. And specifically, there were enough people using it in this way, and enough clinicians, practitioners, and physicians using naltrexone that they've started to do clinical trials as well as clinical studies. So this is one of the first ones that was released last year, because this is not an FDA approved use of naltrexone. This is considered an off-label use. But they wanted to really explore, is this a safe option, number one? And does it help? Number two. So, what they found from this study is yes, it appears to be a safe option for folks with long COVID. And additionally, it does appear to help. Specifically, they said for these long haulers who were on it for a median of 11 months or so, that they noticed a reduction of their long hauler symptoms after about 2 months of taking it. And when they did this subjective patient study here, where they asked, we've got 7 symptoms here of a typical long hauler. Can you rate your symptoms? What they found is 6 out of those 7 symptoms improved after being on that LDN. And once again, it was about an average of 2 months for the patients to start to notice the change there and see those improvements. One of the specific changes that really stood out to us in this study was the reduction of pain overall for these patients. And remember, that pain goes so hand in hand with chronic fatigue and that exhaustion for the body. So this is something that we are using at our clinic for patients. Of course, everything is evaluated as an individual. So we want to talk about what's going on for our patient, what their goals are, what's going on with their lab work, what their trajectory of this illness is looking like. But if it is appropriate, it is a tool that we have used. And I've had several of my long haulers in particular who have found it to be very helpful for them. So we want to have something that will help with that immunomodulation and help reduce some of the negative symptoms that are keeping people from returning to their normal daily lifestyle. And low-dose naltrexone appears to be pretty promising in that regard. So something to talk about with your care team or us if you're interested. Now, we also have several labs, of course, that we run here at Prosper. We do specific specialty panels, of course, with patients. But when it comes to evaluation of COVID-19 and specifically long COVID, we oftentimes are finding ourselves looking at some what's considered more conventional labs. They're very helpful for us. So things like looking at our CBC, which includes our anemia panel, but it also tells us not just about those red blood cells, but also what's going on with our white blood cells, kind of how the body has differentiated those white blood cells, which means kind of what basket they've put the body's put their immune eggs into, so understanding where that immune system is really trying to crank more energy into or is deficient. We also love to be able to look at the organ function, of course, for our patients. So looking at that comprehensive metabolic panel gives us a good idea of what's going on with those eliminatory organs like liver and kidneys, and then also looking at our electrolytes and how our CO2 status is for our lungs, those kind of things. There's a lot of information in those simple labs. Our inflammatory markers can be very elucidating for us as well. So looking at things like highly sensitive CRP, SED rate, also known as EESR, our LDH, which tells us about tissue damage, and then D-dimer, which is a marker that can help us track some of these thromboses or these clots. And then homocysteine, which helps us understand the antioxidant status when we were talking about like glutathione for that endothelial lining of the blood vessels. So helps us understand, does the body have enough antioxidants if it becomes exposed to COVID or is dealing with active COVID, or if we're in a long hauler state. So all 3 of those areas, those kind of inflammatory markers can be very helpful for us for understanding what's going on with our patients. And then vitamin D testing is very core here. This is something we forget to do because It's not always covered by our annual exams and annual panels in conventional clinic settings because of insurance regulations typically. So, vitamin D, we know that if our status is low, it puts us at greater risk once again for getting the virus in the first place, having worse acute symptoms while we have the virus. And then it puts us at greater risk of developing long COVID. So we really want to make sure going in to these waves, especially and writing them out with our community, that we have good vitamin D status. So it's something that we try to check our patients' vitamin D status yearly because it's not something we can just guess. We really want to see what's going on because the liver stores your vitamin D levels for the year. We want to make sure we haven't overshot our mark because that's very dangerous, or undershot it. And, we did a big talk on vitamin D this year too. So please feel free to tap back into that. It talks quite a bit about recommended amounts that we're looking for different subtypes of our population. So different patients have different recommendations there, but we're really looking to make sure that those vitamin D levels are adequate for dealing with this virus. And then we want to know that we're not anemic and that the iron panel is looking good. If iron is too high, that puts us in an inflammatory state already. That can be very damaging for the circulatory system. So we really get concerned when we find that. And once again, that's such a simple lab to run. And then, of course, the annual blood panel. So just a standard annual blood panel, which typically includes our lipids as well. So these are the things that we like to see for our patients, both preventatively, making sure they're ready to go in case they're exposed, because let's face it, we're all going to be exposed or have been exposed, and make sure that our patients who've come through COVID are still having adequate numbers here and are not stuck in that inflammatory mode or stuck in a deficit state for something like iron or their immune system.
Thanks, Dr. Molly. Those labs are so important for helping orient the treatment plan, whether, like Dr. Molly said, it's preventive or in a long COVID situation or a post-viral illness. So we have a bunch of supplements here at Prosper that we just tailor very specifically to to our patient needs. So these are physician grade line of supplements, which means you can't just get them off the internet, right? Which I highly discourage, because I've had a lot of patients recently start something that they got from a tertiary website, supplement from a tertiary website that ended up not being what they thought it was. They got some post-marketing information. The tertiary website said, sorry, we gave you this product, but actually it wasn't that at all. So, it's becoming more and more important to make sure that the supplements you're taking are from a trusted source. And so that's something that we monitor very closely at the clinic, and just pull out the physician grade line of supplements. When it comes to things that are really helpful for prevention as well as acute and long COVID, I've pulled out a couple of the ones we have on the shelf here, from the glutathione all the way on the left-hand side, which is in a liposomal form, which makes it the most absorbable of all the forms. Glutathione is notoriously hard to absorb, but it's such a special antioxidant that needs a lot of formulation around it in order for it to be absorbable in your body. The melatonin there right next to it is a sustained release form, which means it has a longer action. So if you're taking it at night, it sort of acts throughout the night instead of the first few hours. That's a product I like. Like we mentioned earlier, with melatonin, we're talking closer to 9 milligrams to have the adequate antioxidant support on board. Vitamin D, the easiest way to take it is in liquid form. It's probably the yeah, in liquid form, especially with food. I always have patients take their vitamin D with food. And then there's the pro-resolving mediators, the SPM Supreme, with all the fractionated marine lipids in it that have been extracted into this super absorbable form. And then lastly, this product known as Vessel Forte, which has some vascular support on board. Whether it's from the herbal world or the supplement world, there's, I think, some quercetin in this product, as well as some high antioxidant grape seed extract. Some other supplements I didn't add on this page were things like nattokinase or nattocerazine, which are what are known as anti-sclerotics. So they diminish the sclerosis or the inflammation and the scraping in the interior lining of the vessels. So all of those would have a place in the treatment plan for COVID. And then also we've got a physician grade line of herbs, botanical medicine, which are just whole herbs, whether they're encapsulated or in tincture form or in powder. There's that quercetin ascorbate, which is quercetin with the vitamin C added to it. This is in a powder form that allows it to be best absorbed. We also have a tincture here from a local herbalist over in Seattle, who is a mentor of both Dr. Molly and mine, who has a tincture that's called Out of Thin Air, a lung support tincture that helps support the lung tissue, but also prevent those really strong spasms of coughing that sometimes people get with COVID. It's such a dry mucus. The body is trying to get it out. So this is one of the supplements that I end up using from the botanical medicine standpoint for diminishing the severity of that cough, but supporting the excretion of it. Bronchotone is an Ayurvedic combination that takes sort of the Eastern Ayurvedic medicine for lung support and encapsulates it. Ayurveda is well known for taking the whole herb, powdering it, and you just kind of slug it back. And they've sort of made this into a capsule form, so it's a little bit more palatable to the Western audience. And then lastly, the heavy hitter again that we mentioned in the beginning is that andrographis, that highly potent antiviral that has a specific action against that 3CL pro viral protein in diminishing its activity in COVID.
So we want to invite you guys to stay tuned for our next Doc Talk. We always like to tell you what the topic is going to be, but we're not going to this time because we found that it was so important to have something very relevant, and we really want to see what clinical questions are coming up with our client load over the next 2 to 3 weeks. So sometime in early October, you'll get an email saying what it is that we're going to spotlight, and it'll be on the 12th of Thursday around noon. And remember, if you can't make it, no problem. We'll make sure to record that and send you an email as long as you register. And we'll also be posting that to our website. Now, many of you might have questions today, or Dr. Rosalie might have some extra comments here. We want to invite anyone who feels like they need support, or if you have community or family members who need support with COVID, please know that we are here to help our community. Give us a call. We'll get you set up with a consult or even a meet and greet to make sure that we're a right the right fit. You can also check our website out, and there's a place to go on and book there. Same thing if you need an apothecary product. It's always good to check with your practitioner or your provider first before starting anything. But we do have that apothecary if you are needing something that you saw in the talk today. So just let our staff know and they can help you get that filled. And we are really just thankful for you guys for showing up today. And we hope that some of this information was a good stepping stone, starting place for you to really do some more research for what might be helpful for you. And I hope you learned some stuff. It was really fun diving into that literature and looking at the very latest stuff that's come out in the natural realm. So I know that right now we're in such a big COVID spike here in Port Townsend that we've run out of Paxlovid, for example, at our local pharmacies. So there are a lot of people looking for alternative options that are still going to be safe and supportive for them. So yeah. Anything else, Dr. Rosalie, or any questions? You can put it in the chat box if you have any.
Yeah, I just, I just want to mirror what Dr. Molly said. This is so fun for us to really dive into the literature, and I hope you guys had some fun too and learned a couple of things. If you have questions, even after the fact, you can call the clinic or send a message through the portal to your doctor. And we also welcome suggestions for upcoming doc talks too. If there's something that you really want to know more about, feel free to also suggest it to us, and we'll see if it makes sense in the grand scheme of things. But yeah, thanks all for being here.
Yep. All right, if there's no other questions, we'll let you guys get on to your beautiful days. It's so sunny and gorgeous here. Enjoy. Right. Be well, everyone.